Okay, so just going to allow a few minutes to pass so more people can join, and then we'll get started. I'm super excited. Thank you to everyone who is joining in today. I know it's midday. Hopefully, your days are going well, not too overwhelmed with work and all of the other things. Um, yeah, we're going to get started really soon. I'm super excited about today's discussion. If you don't mind, if you want to just say hello in the comments or let me know where you're tuning in from, that would be great. For those who don't know, my name is Dr. Sharis Chambers, also known as the Period Doctor, and I'm going to be with you guys for about 30 to 35 minutes this afternoon, talking about a topic that's near and dear to my heart, and hopefully we'll all learn something. My other hope is that you will feel comfortable enough to ask questions in the comment section. There are no silly questions. Of course, the topic for today is going to be about gynecologic cancers and awareness. Hi, Jody. Thank you for joining in from Indianapolis. That's awesome. I'm just going to give it about another minute or so to allow folks to trickle in, and then we'll get started. Again, my name is Dr. Sharis Chambers. I am going to be talking about gynecologic cancers, which is super, super important. There's definitely not enough awareness on this topic. And my hope today is to increase awareness and also to just kind of give you a good overview on the 5 gyn cancers and things you can do to hopefully decrease your risk and just navigate gynecologic awareness and gynecologic health with greater confidence and understanding. All right. So I'm just going to check in and make sure my moderators are good to go. And then we'll get started. Okay, so hi everyone, I'm Dr. Sharis Chambers, also known as the Period Doctor, and it is my pleasure to welcome you all to this important Facebook Live event. First, I'd like to extend a heartfelt thank you to the Foundation for Women's Cancer, or FWC, for their partnership on this important topic. Their dedication to gynecologic cancer research, education, and awareness truly inspires me, and together we're here to make a difference. So the primary aim of our discussion today is going to be to shed light on a topic that's both vital and often overlooked. So gynecologic cancers and the importance of regular screening tests. So it's an issue that touches the lives of countless women, and knowledge is a powerful, powerful tool. So our focus today is going to go beyond just general awareness. We're also going to address and break down some cultural barriers that often stand in the way of Black women accessing the care and information they need, particularly concerning uterine or endometrial cancer and cervical cancers. It's a topic close to my heart, and one that I believe needs more attention and more dialogue. So, as we navigate through this event, we'll underscore the importance of early detection and how it can significantly improve outcomes. Remember, being proactive about your health is one of the greatest forms of self care and empowerment. So let's dive into this journey of awareness and advocacy and action. As a reminder, please feel free to ask questions in the comments, and I'll do my best to address them at the end. So thank you again for joining us today. So to start, I do want to do an overview of the 5 gyn cancers. So to just list them outright, we've got cervical, and then uterine and or endometrial. Those are kind of combined. Ovarian, vaginal, and vulvar. So to start, I want to start with cervical, and I've got my trusty little diagram, so I'm going to point it out and do a little bit of an anatomy discussion at the same time. So if we're talking about the cervix is located down here. It is the opening to the uterus, so it is what connects the vagina and the uterus. So cervical cancer affects this area here. When we think about cervical cancer and how we screen for cervical cancer, we're typically thinking about pap smears. So pap smears, by definition, require insertion into the vagina and then typically a sort of swab that collects cells from the cervix. And that's what pap smears do, which is why they screen for cervical cancer. So when we think about symptoms, cervical precancers, or the cells that have changed that are leading to cancer, typically don't have symptoms. And that's why pap smears and pap tests are so so important. A person usually does not have any signs or symptoms until those cells go from precancer to cancer. And that change really is dictated by those cells actually causing invasion into the deeper parts of the cervix and into other parts of the pelvis. So, symptoms that occur when cancer does occur, again, because those precancer symptoms don't often, the precancer changes don't often have symptoms, are going to be vaginal discharge, abnormal vaginal bleeding, vaginal odor, and typically pain. Now, of course, these symptoms can be caused by cervical cancer or by other health problems. So it's important to see your doctor if you're having those issues. Again, cervical cancer is the one that falls under the the umbrella of structured screening tests. So there's structured screening pap smears that start for the general population at age 21. And so when we start our pap smear screening, we should follow up with that regularly. And that is actually determined by what your pap smear showed, whether there was presence of HPV, and what your age is and other risk factors. And so I can't tell you exactly when your next pap smear should be. You need to determine that with your doctor based on your age, your risk factors, and what your prior pap smear screening showed. Okay, so the next cancer of the five gyn cancers is uterine or endometrial. So what that looks like is the uterus is actually the structure here, also called the womb. The uterus actually includes a lining on the inside. So the uterine lining is also called the endometrial lining. And so cancer of the endometrial lining is endometrial cancer. We also say that there's uterine cancer because there can be cancer of the smooth muscle of the uterus as well. And so we put those together because they affect the same organ. The most common warning sign for any uterine cancer is abnormal vaginal bleeding. So, in order to actually see if you have abnormal bleeding, you have to know what your normal bleeding looks like and pay attention to those changes. So, recognition of this symptom often affords an opportunity for early diagnosis and treatment. Now, if you are postmenopausal, so you've gone through menopause, meaning you have gone a full year without having periods in the kind of normal physiological state. So typically around the age of 51 is when menopause occurs. Any bleeding or spotting after you've gone through menopause is abnormal and should prompt immediate evaluation by a gynecologist. So, uterine and endometrial cancer, the most common symptom that we're going to see is actually going to be abnormal vaginal bleeding, specifically for folks who've already gone through menopause. Any bleeding at all, light, just a little bit of bleeding is still abnormal. And that should trigger in your mind that you need to go see your doctor. You need to see a gynecologist for further evaluation. Any questions so far? I see a lot of folks are tuning in from all over. It's so great to have you guys here. I'm currently going through the five gyn cancers. We've already touched on cervical and uterine slash endometrial. So now we're going to move on to ovarian. Please feel free to go ahead and type any questions if they arise, and I'll do my best to answer them. Okay, so ovarian. Now, we have ovaries on both sides of the uterus. They are connected to the uterus via this ligament, but they're actually not connected to the fallopian tubes. There's space there. The fallopian tubes drape over the ovaries to pick up eggs. Ovarian cancer is cancer from the ovaries. Now, sometimes we kind of include cancer around the fallopian tubes and other things, but we're primarily talking about cancer from the ovaries, which are these small little organs on both sides of the uterus. Now, historically, for ovarian cancer, symptoms were not thought to develop until the chance of cure was very, very poor. It was actually termed the silent killer because of this, because you wouldn't necessarily have symptoms before things got very serious or very severe. However, more recently, we have studies that show that many symptoms, especially if they are new, if they're persistent or worsening, are more likely to occur in people with ovarian cancer than people just with ovaries in the general population. So even patients with early stage disease can have these symptoms. These symptoms include bloating, pelvic or abdominal pain, difficulty eating or feeling full very quickly. The term is early satiety. Or urinary symptoms, like I really have to go to the bathroom, like urgency, or I need to go to the bathroom so much more often, which we call frequency. So while these common symptoms can be seen in people who do not have cancer, patients with ovarian cancer report these symptoms being persistent and often progressive, and it typically represents a change from their normal symptoms, from what's normal for their bodies. So those are the things you'd want to look out for as it relates to ovarian cancer. All right, moving on. Our next cancer is going to be vaginal cancer. And that's typically, occurring in the vagina. The vagina is the portion on the inside, right? So the vagina is here. It's actually what connects the vulva, so the vulvar area, to the cervix. The bridge in between that is going to be the vagina. Now, vaginal cancer, especially in the precancerous and early stages, may not cause symptoms. Common signs for more advanced vaginal cancer include unusual vaginal bleeding. So that's bleeding between periods or bleeding after intercourse, or again, new postmenopausal bleeding. There can also be pain. That can be vaginal pain or vulvar pain, pain that's in the lower abdomen or lower pelvis, and even in your back or kind of the flank, which is the sides of the back. You can also have problems with urination or problems with bowel movements. Some people also notice watery vaginal discharge, and then you can actually feel a lump or a mass in the vaginal area, which could also be a sign or symptom of early or even advanced vaginal cancer. So it's important to know that it could be as simple as just a change in discharge, being watery discharge. There could be some pain, and then there could also be something that you can feel with the touch. And then the last of the five gyn cancers is vulvar cancer. So vulvar cancer is kind of difficult to highlight on this diagram because this diagram shows things that are internal. The vulva is external. So that includes the external genitalia, including the labia, so the larger lips on the outside, the smaller lips on the inside, the clitoris, the urethra, the opening to the vagina, and the perineum. So symptoms or signs of precancer and cancer for vulvar cancer include chronic itching. When we say chronic itching, we typically mean for more than 1 to 2 weeks. Skin that appears different than usual. So that could be different colors, so red or pink or black or white, as well as differences in shades, so skin that's getting lighter or skin that's getting darker. You can also feel a bump or a lump, not dissimilar from vaginal cancer. That could be a red bump or lump, pink or white. It could have even wart-like changes or a raw surface. You can also have pain or burning, bleeding or discharge that's not related to the normal menstrual period, and then sometimes even like an open sore that looks kind of ulcerative, especially if it lasts for a month or longer. And then cauliflower like growths. We really mean like appearing like cauliflower, like that abnormal kind of budding appearance. All of those things are signs or symptoms of vulvar cancer. Now, for folks who are just tuning in, again, I'm highlighting the five gyn cancers. This is in partnership with the Foundation for Women's Cancer, and feel free to put any questions that you may have in the comments. So, when we talk about just how significant the five gyn cancers are, every 5 minutes, a woman is diagnosed with one of the five gyn cancers. So that's totaling nearly 115,000 Americans each year. Many of these people are not diagnosed until the later stages of their disease, and that results in more than 34,000 people dying each year from gyn cancer. A lot of folks don't realize this, but these cancers affect people of all ages, from teenagers through folks to their 80s. So, this is why we feel like this topic is so important. It's important to understand the breadth of it all, the impact of it all, and what we can do to affect change. This is also why annual visits and regular screening tests are so important in cancer prevention. So when we think about the gyn cancer screening process, we typically think about pap smears, right? So pap smears along with HPV testing are important in preventing cervical cancer primarily. Um, it's important to remember two key things about pap smears. So, not all of your GYN exams or even pelvic exams are pap smears. Pap smears require specific collection of the cells of the cervix for it to be a pap smear. Sometimes we do gyne exams or pelvic exams for anything. We could just be looking at discharge. We could be testing for infections. There's a number of reasons to do pelvic exams, and not every pelvic exam is a pap smear. That's important to know because I've had people say, well, I just had a pap smear in the ER. Emergency rooms are typically not going to do pap smears. They'll do pelvic exams because of whatever your complaint is, but they're not doing the regular screening of a pap smear. It's important to know that your pelvic exam included a pap smear to know when your last pap smear was. The other important thing is that pap smears do not screen for all gyn cancers. So a pap smear is not going to screen for ovarian cancer. It's not going to screen for uterine cancer. It's not going to screen for vulvar cancer necessarily. Those are things that actually come up typically when you are an established patient with a gynecologist and you're coming in for complaints of symptoms or getting routine exams and things are found like bumps or discoloration that prompts further evaluation. So I hope that makes sense. The other thing that's important is that not all gyn cancers even have formal screening tests. So again, of course, we have our pap smears for cervical cancer, but for uterine cancer, there isn't a routine screening test. For ovarian cancer, there isn't some routine screening test that says, hey, we start at age 20 and continue at this frequency. So again, those things tend to be found once symptoms have developed and once you're in for a routine exam with your provider. Having said that, if we're not aware of the symptoms, we can't report them. If we're not in regular relationship and if we're not getting our regular checkups with our providers, we don't have the opportunity to then actually express or report those symptoms. And so that limits our ability to have a timely diagnosis or timely evaluation. I hope that makes sense. Any questions, please again enter those into the chat and just let me know if you need me to repeat anything or if there's anything that's unclear. Another important point to highlight is that there's actually a vaccination that can decrease cancer risk. So the HPV vaccine is something that we actually recommend to help prevent certain types of gyn cancer. We typically correlate that to cervical cancer, but it can also help prevent certain types of vaginal cancer and vulvar cancer as well. So that's one of those major things that you can do to help decrease your risk of a gyn cancer. Any questions, please just put them in the chat. So I'd like to also shift my focus to now for uterine and endometrial cancer and cervical cancer. So it's important to remember that cervical cancer again affects the cervix, which is the opening of the uterus, and those symptoms include excessive discharge and abnormal bleeding between periods, and also can include bleeding after menopause. Uterine or endometrial cancers affect the uterus, which is the structure here, the womb, and the uterine lining. Those symptoms also include abnormal vaginal bleeding, where younger women who also have not gone through menopause should also pay attention to just irregular or heavy vaginal bleeding. Sometimes being without periods or having infrequent periods can also be a symptom. So skipping periods for a long period of time can also increase your risk of uterine or endometrial cancer. And then bleeding after menopause, as I previously stated, it is never normal to have bleeding once you've gone through menopause. Even brown spotting or a single spot of blood or really light bleeding is still considered to be abnormal and should, in your mind, prompt that you need to have a gynecologic evaluation. Okay, and then for cervical cancer, I want to shift and talk about risk factors. So almost all cervical cancer is caused by persistent HPV infection. And a lot of folks don't realize that. First, HPV is the most common sexually transmitted infection in all people. But it's persistent HPV infection with certain types of HPV that lead to cervical cancer. Cervical cancer usually affects women between the ages of 30 and 50, but younger women are also at risk. Another risk factor related to cervical cancer includes smoking. So smoking weakens the immune system, which can lead to the persistence of HPV infection. What people don't realize is that HPV can come around and then actually be cleared by the body when there's a strong immune system. That's more likely to occur in much younger folks. But if we have anything or have any type of hobby or activity that decreases the effectiveness of the immune system, then HPV is more likely to stick around, and then that can increase your risk of cervical cancer. And now, let's talk about risk factors for uterine or endometrial cancer. Taking estrogen alone without progesterone increases the risk of uterine or endometrial cancer. Not maintaining a healthy weight, specifically obesity, is going to be a major risk factor for uterine or endometrial cancer. Late menopause or menopause that occurs after the age of 52 is another risk factor. Diabetes or high blood sugar, so too much sugar in the blood, is another risk factor for uterine or endometrial cancer. Not bearing children, so deciding not to have children or not being able to have children, also increases your risk of uterine cancer. Hypertension or high blood pressure, that's another risk factor. And then finally, a family history of endometrial or colon cancer. And then more rarely, the use of tamoxifen. That's an estrogen receptor modulator medication that's used to treat breast cancer. We know that's super important. It's very helpful for breast cancer treatment, but it is associated with an increased risk of uterine or endometrial cancer. Now, the reason I highlight cervical and endometrial cancer is for both of these cancers, Black women are more likely to be diagnosed at a later stage or have more advanced disease at time of diagnosis and are more likely to die from their disease. And so I do want to focus on what makes this different for Black women and kind of review those risk factors and see how does this affect Black women differently. So, when we think about the risk factors and opportunities for prevention in cervical cancer, they're directly tied to access to care, specifically regular screening and HPV vaccination. So, much of my work and education centers around emphasizing the importance of regular and consistent gynecology care. So, systemic barriers, so that can be any barriers within the system of medicine, within the system of healthcare, provider bias, and cultural mistrust also play a role in decreasing preventative gynecologic care in the Black community. I want to highlight that the mistrust is valid. There are multiple accounts, especially in American history, where there has been medical mistreatment of Black women, especially as it relates to reproductive health and gynecology. So that's a valid concern, and there's historical context there. There's also systemic barriers that include issues that affect access to care, like financial barriers, physical distance from providers, and inability to access specialists, and more. And then provider bias is real, especially in a country with a history of race based discrimination. So it's important to find a provider that you trust, who connects with you, who you feel like actually listens to your concerns. Now, when we look at endometrial cancer risk factors, weight issues, specifically obesity, and diabetes, as another risk factor, and hypertension, are all risk factors that have a higher prevalence in Black populations. So, by focusing on preventing these things or reducing these issues, we may be able to also improve endometrial or uterine cancer risk as well. Okay, so I know that was a lot. I definitely want to give you guys an opportunity to type any questions that you may have in the comment section. Let me know if I'm going too fast or if there's any other questions or concerns, anything that you didn't understand. Again, the purpose of today is to highlight the 5 gyn cancers, specifically to increase awareness as it relates to prevention and the need for screening for folks who are in the Black community, mostly because the risk of endometrial or uterine cancer and the risk of cervical cancer is so much higher for Black women. Okay. Now, one other thing that really is just a universal truth is that it's super important for us to detect cancer early, because cancers have better outcomes the earlier they are diagnosed. So, really, the importance of awareness and the understanding of the signs and symptoms, that's going to be really important because, as I previously stated, many of our gyn cancers don't have formal screening tests. They rely on patient reports of abnormal symptoms to prompt that further evaluation. And then, of course, there is the role of regular screenings, and those screenings, especially pap smears, have been proven. They have been shown to help prevent cervical cancer and decrease that risk of cancer. One person highlighted that we should address itching as a sign of cancer, and that's primarily going to be a sign of cancer for the vulva. The vulva is the external genitalia. So you're unlikely to have itching for ovarian cancer or uterine cancer because those organs are higher in the pelvis. But the vulva definitely has an association with itching as one of the signs of the presence of a vulvar cancer. So don't even ignore just itching. Most people think, well, itching is just a normal thing. I have skin, I'm going to have itching. But itching, especially persistent itching of the vulva, is going to be a major, major thing that you don't want to ignore. Speak with your gynecologist and have them look at that area, see if there's any other changes in color, changes in texture that might prompt them to evaluate you further. Now, another thing that I do want to highlight is that it's not just important to have testing before, not just for testing to prevent things. Once you are diagnosed with a gyn cancer, testing remains important. And what I mean is, there is tumor testing or evaluation of certain characteristics of your specific type of cancer that can help guide more precise treatment of the disease and also improve outcomes. So science has gotten really good that it's not just your cancer, but what about your cancer can we trigger? Can we actually focus on and target to improve your outcomes? So testing and screening is a part of just being healthy and preventing cancer, but once we actually get that diagnosis, further testing can help us fight that cancer and hopefully get into remission and get to a place where we achieve health again. Um, and then I have another question. Does the likelihood of being diagnosed with a gyn cancer lessen with age? Not necessarily. As we look at the age distribution of most gyn cancers, they actually increase as we get older. That can be for a variety of reasons. Most cancer is caused by abnormalities of DNA. And so, what it's basically the information that tells our body how to create more cells. Cancer is abnormal. And so, as we get older, as we continue to create more cells, our body just kind of gets bad at DNA. There's different changes and injuries that occur to our DNA. That's what HPV does. It actually affects the DNA of our cells. Those changes actually tend to worsen as we get older. And so most kind cancers are actually going to affect those who are older. And so you actually see a bit of an increase as we age. That's a great question. One other thing I do want to highlight are just practical tips for you guys to advocate for your health. So, some of those things include, of course, staying up to date on your regular checkups and screenings, taking advantage of proven cancer preventing vaccinations like the HPV vaccine. I wish we had more vaccines, but this is our major one. It's a pretty huge deal in the gynecology community. And then knowing and not ignoring the symptoms that we've discussed today that are associated with gyn cancers. And then talking about this with your family members, talking about this with the people you love, the people you come in contact with, so that we continue to increase awareness. It's also important to feel confident in discussing your concerns with your healthcare provider. And then, and this is super important, seek out second opinions when necessary. Second opinions should not offend good doctors. Doctors want you to know what you're getting into and know and feel confident with your treatment plan and your diagnosis. So whether you need a second opinion on diagnosis or second opinion on treatment plan, it's appropriate to do so, and you should feel confident doing so when necessary. Now, the Foundation for Women's Cancer specifically urges everyone to learn, listen, and act. So learning is learning the symptoms and risk factors for each gyn cancer, which we've really touched on today. So I'm super excited about that part. We're doing the learning. Listen to your body. That's something that you have to personally do every day in the comfort of your home. Listen to your body. Get to know your body and say, is this different? Is this abnormal for me? It doesn't have to be abnormal for someone else. It needs to be abnormal from what you consider to be normal for your body. And that is when we then get to the other point of acting. Acting and taking those steps to either speak up to your doctor or take the preventive steps to lower your risk for gyn cancer. I have one other question. How quickly do gyn cancers progress? That actually varies depending on the type of gyn cancer. What we do know is that cervical cancer tends to be a bit slower, which is why it's kind of the perfect one for screening tests. It can take about 10 years from onset or initial infection of HPV to development of cervical cancer. And so it's good that we have that longer lead time, which is why screening works so effectively. Other cancers, depending on the type, ovarian cancers, they can be very progressive or aggressive rather, and progress quite quickly. So it's hard to know exactly how quickly they progress, but most of our cervical cancers are going to have a little bit of a slower progression from when we can detect initial HPV infection or precancerous changes to true cancer. It's difficult to know exactly how quickly most gyn cancers progress because we catch them so late. So we'd have to kind of screen over and over again to get that full timeline, and we just don't have that information. But that's a great question. Another thing to know is that 8 in 10 of our gynecologic oncologists, so those are the cancer doctors that are dedicated specifically to gyn cancers, believe that lack of awareness is the biggest barrier to early detection. So that's why we're having this event today. That's one of the major focuses of the Foundation for Women's Cancer. And if you want to improve your awareness beyond just this setting, you can check out the Foundation for Women's Cancer website, which is foundationforwomenscancer.org. It is a valuable resource for additional support and information about the 5 gyne cancers. They actually have a lot of brochures and a variety of different languages so that it's accessible to multiple people. Now we're kind of towards the end. We have about 5 minutes left. I know we've been answering some questions. I do have some other questions that did come in, so I'm going to spend a little bit of time answering those. Please feel free to also still add your question to the comment section. So one of the questions that came in earlier was, what does my annual pap smear screen for? I want to highlight something that's important. Not all pap smears are annual anymore. We used to have pap smears every single year. Now it's important to go in for an annual visit with your gynecologist, but they may not do the pap smear. It doesn't mean that they're not caring about your screening. It's just that screening has gotten so much better with the addition of HPV testing that we now know that we don't necessarily have to do screening every single year. It can be spaced out to every 3 years or even every 5, depending on what your prior screening shows. So it's not that you have to have an annual pap smear, it's that you need to be up to date with your pap smear screening according to you. So according to your age, your risk factors, and your prior pap smear results. That's something that you can determine by speaking with your qualified healthcare provider. Now, pap smears screen for and help prevent cervical cancer. There's rare scenarios in which you might detect a vaginal cancer, but pap smears are not going to screen for vulvar cancer, ovarian cancer, or uterine or endometrial cancer. And that's super important to know because that requires us to pay attention to our body and really look out for those symptoms that we previously discussed. Another question is, are there any lifestyle changes or habits that can help reduce the risk of gyne cancers, particularly uterine or endometrial and cervical cancer? So we talked about the risk factors, and so some of those lifestyle changes are going to be changing those risk factors. For cervical cancer, making sure that we try our best to quit things like smoking and things that impair our immune system. That's something that we can all focus on. I think we're at a point in our society where we know that smoking and tobacco use are not helpful for our health, but specifically for cervical cancer, that's something that can be modified to decrease risk. For uterine and endometrial cancer, maintaining a healthy weight, modifying and managing our comorbidities or other conditions like diabetes and hypertension, those things also help to decrease uterine and endometrial cancer risk. And then just being active and having a more balanced diet, those things are also going to help as well. Another question I have is, can you share some strategies for initiating conversations with healthcare providers about gyne health and health cancer screenings? So one of the strategies I always recommend is telling your doctor, I'm concerned. I'm concerned about gyne cancers. I'm concerned about my family history of uterine cancer. I'm concerned about my personal risk of cervical cancer. By stating that you are concerned, that you have an interest in, and why you're concerned, that can really open up the conversation with your healthcare providers. They can say, oh, I didn't realize you were concerned. Let's talk about your unique risk. Or let me review your history. Who in your family has this condition? How young were they? How many people have it? What was the outcome? Those things are great conversation starters with your healthcare provider to make sure that you are getting your gyne health and gyne cancer screenings addressed appropriately. Now, we're running out of time, but I do just want to give one last opportunity to offer some questions in the comments. And if I can't answer your question today, maybe I'll be able to answer it a little bit later via Instagram or Facebook. But ultimately, I do want to thank you all for joining us today for this very important discussion in partnership with the Foundation for Women's Cancer. We hope that you now have a better understanding of gyne screening tests and gyne cancers. And I want you to remember that your health is a priority. Together, we can make significant strides in early detection and advocacy. And it's important to keep this conversation going. Talk to your family members, talk to the people you love as we gather around the holidays. Make sure that health is at the forefront of our conversations. And feel free to visit the FWC website at foundationforwomenscancer.org for more resources. Let's continue to support each other in our health journeys. Thank you all once again. Stay healthy and stay informed. Thank you for joining me.